9. Warning signs in your feet that could mean diabetes. Your feet might be sending crucial warning signs of diabetes right now, signals that frequently go unrecognized. From subtle numbness to peculiar skin changes, these symptoms often emerge early in the progression of high blood sugar, yet they are dangerously easy to overlook. Many people mistakenly believe that diabetes can only be detected through a blood test, a doctor's visit, lab work, and then a diagnosis. While blood tests are definitive, the body often provides signals about elevated blood sugar levels long before any lab result confirms it. The earliest and most frequent place these warnings appear is in your feet. Understanding these indicators can be life-saving, as countless individuals have experienced these subtle hints for months, even years, without grasping their significance. Today, we aim to shed light on these critical signs. It is common for individuals to dismiss early foot symptoms, attributing them to age, fatigue, or other benign causes. However, a significant portion of the population lives with undiagnosed diabetes, quietly suffering damage to their nerves, kidneys, vision, and certainly their feet. The good news is that early detection, often through a simple blood test, can make a profound difference. But before reaching that stage, it's essential to know what physical cues to look for. Let's delve into 9 critical signs that you should never ignore. One of the most frequently experienced and easily explained away symptoms is a persistent tingling or numbness, that familiar pins and needles sensation in the feet. While it's normal for a foot to occasionally fall asleep due to pressure or position, it becomes a concern when this sensation occurs regularly without a clear external reason. This frequent recurring numbness, or tingling, medically termed peripheral neuropathy, is one of the earliest indications that blood sugar levels have been elevated for a sustained period. The excess sugar in the bloodstream acts like an insidious agent, slowly attacking the protective outer layer of the nerves. This is a gradual process, which is precisely why it often goes unnoticed until the damage is more advanced. To understand this, consider your nerves as essential electrical wires, each encased in a protective plastic coating. This coating is vital for allowing signals to travel cleanly and efficiently from the brain to your feet. When blood sugar remains consistently high, it's akin to an acid slowly eroding through this protective coating. The nerve, or wire, might still function for a while, but the signals begin to become distorted or fuzzy. This fuzziness is precisely the tingling or numbness that is felt. Research shows that peripheral neuropathy affects nearly half of all people with diabetes, making it the most common complication, and it almost invariably originates in the feet. This means that millions are experiencing this tingling and are dismissing it as inconsequential. Do not make this mistake. To help protect your feet and promote healthy blood flow, incorporate a 20 to 30-minute walk into your daily routine. This doesn't need to be a strenuous jog. A steady, purposeful walk is sufficient. Additionally, begin reducing added sugars in your diet starting today, as this is crucial for managing blood sugar levels and protecting nerve health. Another distressing symptom, often reported as particularly troublesome at night, is a burning sensation in the soles of the feet. Many individuals might attribute this to being on their feet all day, environmental heat, or general fatigue. While these can sometimes be factors, a persistent feeling that the feet are on fire, especially when lying down and trying to sleep, warrants serious attention. This burning, particularly in the soles and occurring at night, is a classic early indicator of diabetic neuropathy. What is happening internally is that the nerves in the feet, already damaged by prolonged exposure to excess sugar, are now sending incorrect signals to the brain. The brain interprets these misfired signals as a heat sensation, even though nothing physically hot is touching the foot. It's like a faulty fire alarm. The building isn't actually ablaze, but the alarm is blaring because its sensor is damaged. Similarly, the nervous system is misinterpreting internal distress. The burning sensation is not external. It arises from within damaged nerve tissue that is signaling for help. Studies have found that burning foot pain is among the earliest reported symptoms in patients later diagnosed with type 2 diabetes, sometimes appearing 1 to 3 years before a formal diagnosis. To support nerve health and overall bodily function, 2 daily habits are highly beneficial. First, aim to drink at least 8 glasses of water daily. Proper hydration assists the kidneys in flushing out excess glucose and supports the integrity of nerve tissues. Second, consciously increase fiber intake with every meal. Foods rich in fiber, such as vegetables, legumes, and oats, slow down the absorption of sugar into the bloodstream, which is precisely what damaged nerves need to recover and function better. It is crucial to pay very close attention to the next sign, as this is where discomfort transitions into genuine danger, often leading individuals to seek emergency care. This sign manifests as small wounds, such as blisters from shoes or minor cuts, that simply refuse to heal. Patients might report a small injury that occurred weeks ago, which they assumed would close on its own, as most small wounds typically do. However, when blood sugar levels are consistently elevated, the body's remarkable ability to heal efficiently is severely compromised. High blood sugar causes blood vessels throughout the body, including the tiny capillaries in the feet, to narrow and stiffen. This impairment means that essential healing components, oxygen, white blood cells, and vital nutrients, cannot reach the wound site quickly enough. The wound remains open, vulnerable, and extremely slow to close. Visualize trying to water a garden with a severe kink in the hose. The water is available, but it cannot reach its intended destination. This analogy perfectly illustrates what high blood sugar does to circulation in the feet. The necessary healing ingredients are present in the bloodstream, but they are prevented from reaching the wound. An open wound that fails to heal is an open invitation for infection. Diabetes-related foot ulcers are a leading cause of non-traumatic lower limb amputations, with a vast majority preceded by a seemingly minor wound that was neglected. Therefore, make it a habit to regularly inspect your feet, especially after bathing. Look carefully between every toe and at your heels. If any cut, blister, or broken skin is observed, clean it thoroughly with mild soap and water, apply an antiseptic, and cover it. If there is no significant improvement within 48 hours, contact a healthcare professional immediately. Prompt action is vital. Another warning sign often hides in plain sight, frequently overlooked, even though it is visibly present every day. People often walk past this symptom without realizing its significance. This involves visible discoloration of the feet, particularly around the ankles, which may appear darker or more reddish. Individuals might dismiss these changes as sun damage or naturally darker skin tones. However, a specific pattern of discoloration, especially in the ankle region, can be a critical indicator of blood sugar risk. When high blood sugar compromises circulation, the lower legs and feet do not receive an adequate supply of fresh, oxygenated blood. Consequently, the skin's color changes. You might observe a darkening, a deep red hue, or even a bluish tint around the ankles. This visual cue from your skin is signaling that blood flow to that area is insufficient. In some cases, the skin in these affected regions also becomes noticeably thinner and more fragile, further demonstrating that the tissue is not receiving proper nourishment. Think of your blood as a delivery service, transporting vital oxygen and nutrients. Your feet are located at the very end of the longest delivery route in your body, furthest from the heart. When the roads, blood vessels, become narrowed or damaged due to high blood sugar, these essential deliveries are delayed or fail to arrive on time. The skin, deprived of fresh oxygen, changes color as a visible distress signal. Recognizing this particular change can be an early indicator, with studies suggesting such skin changes can be detectable well over a year before a formal diabetes diagnosis. To counter this, dedicate 5 minutes each morning to ankle circles, toe raises, and calf stretches. Even this modest amount of movement can significantly improve blood flow to your feet. If direct exercise is difficult, simply elevating your feet slightly while seated can also provide a meaningful boost to circulation. The fifth sign can be quite surprising because it often appears completely harmless, existing for years without any connection to blood sugar levels. This refers to chronically cracked heels, which are often attributed to dry skin, especially in winter. While dry skin is a common cause, persistent and severe heel cracking that occurs even in warmer months, or that resists all attempts at moisturizing, tells a different story. Diabetes can affect the autonomic nerves, which are responsible for controlling automatic bodily functions, including the regulation of moisture and sweat in the skin. When these crucial nerves are damaged, the sweat glands in the feet stop functioning correctly. As a result, the feet lose their natural internal moisture, and no amount of external lotion can address the underlying cause. Imagine your skin as a protective wall where the mortar between the bricks is regulated by these autonomic nerves. When these nerves are compromised, the mortar starts crumbling, leading to cracks. These cracks in the skin of your feet are not merely cosmetic, they represent open portals for bacteria and potential infection. In a foot with already impaired circulation, such an infection can quickly escalate into a very serious condition. Severe heel cracks, particularly those that bleed and have resisted years of moisturizing efforts, are often indicative of a deeper nerve problem rather than just a skin issue. Chronic, hard-to-treat heel cracking is recognized as a significant indicator of autonomic neuropathy in older adults, a condition directly linked to long-term elevated blood sugar. Autonomic neuropathy is not a minor inconvenience. It signals that the nervous system is under considerable stress. To address this, make it a habit to moisturize your feet thoroughly every night before bed using a good lotion or pure coconut oil, applying it well to the soles and heels. However, it is important never to apply moisturizer between your toes, as trapped moisture there can promote fungal infections. Furthermore, ensure you drink 8 glasses of water daily, as your skin requires hydration from the inside as much as it does from the outside. Moving on to a more serious sign that often signals kidney involvement. Consistent swelling in the feet and ankles, particularly with deep sock marks at the end of the day, warrants immediate attention. While occasional swelling due to prolonged activity is normal, persistent edema changes the picture entirely. High blood sugar can negatively impact the kidneys, which play a central role in maintaining the body's fluid balance. When kidney function is compromised by years of elevated glucose, fluid begins to accumulate in the lowest parts of the body, your feet and ankles. This swelling, known as edema, is a visible indication that your body's essential filtration system is under stress. Think of your kidneys as the body's filtration plant, where every drop of blood passes through to be cleaned. When high blood sugar damages these delicate filters, the system can become backed up, causing excess fluid to have nowhere to go but downwards, where gravity causes it to pool in the ankles. If you press your finger into the swollen area and the indentation remains for a few seconds, this is known as pitting edema, a symptom that should never be ignored. Diabetic kidney disease affects a significant portion of adults with diabetes, and lower extremity edema is often one of the first visible signs of impaired kidney function. To help alleviate this, elevate your feet above the level of your heart while resting, even by a few inches on a pillow. This simple action helps to draw accumulated fluid back towards the core of your body. Additionally, reduce sodium intake in your diet, as salt causes the body to retain water, significantly worsening edema. Always read food labels carefully, as many canned and processed foods are surprisingly high in sodium. If you notice new, persistent, or worsening swelling, consult a healthcare professional at your earliest convenience. It is important not to wait for it to become a more significant problem. The next sign is frequently misdiagnosed, particularly in men, who might live with and inadvertently mask it for years before its true origin is discovered. This involves chronic foot pain, often mistaken for arthritis, tendinitis, or an old injury. Many individuals report taking over-the-counter pain relievers for months, believing their discomfort stems from common musculoskeletal issues. However, sometimes the pain originates from a completely different source, one that standard painkillers cannot effectively address. When nerves are damaged by chronic high blood sugar, they do not always simply become numb or quiet. Instead, they can become hyperactive, firing random, intense signals that the brain interprets as severe pain. Individuals describe this as stabbing, electric shock sensations, or a feeling of a hot needle piercing the foot. This phenomenon often intensifies at night when other sensory distractions are minimized. Consider a car alarm that has been damaged in a minor accident. Every few minutes, it might inexplicably start blaring, even though there's no actual threat. The alarm itself is broken. Similarly, a damaged nerve sends alarm signals to the brain when no external injury or stimulus is present. The pain experienced is entirely real, but its source is nerve dysfunction, not a physical injury. Masking these signals with pain relievers does not address the underlying nerve damage. Instead, it silences a crucial message your body is desperately trying to send. Painful diabetic neuropathy affects a notable percentage of individuals with diabetes and is frequently misidentified as other common aches and pains. To promote nerve health and reduce discomfort, incorporate 5 minutes of gentle foot and ankle stretching into your morning routine before getting out of bed. Flex your feet, circle your ankles, and gently pull your toes back to encourage blood flow before you bear weight. Additionally, consider a gentle 3-minute foot massage every night before bed, using light circular strokes along the sole and up the ankle, which can be very beneficial for nerve stimulation. An important indicator that suggests a more advanced stage of progression is persistently cold feet. While many people believe they have always had cold feet, especially in winter, the concern arises when feet remain cold regardless of the surrounding temperature. Cold in summer, cold even under multiple blankets, and cold even when the rest of the body feels warm. Such enduring coldness is a strong indicator of significantly compromised blood circulation in the lower extremities. The blood vessels have narrowed or stiffened to a degree where warm blood simply cannot reach the tips of the feet in sufficient volume. Visualize your blood vessels as a heating system with pipes running to every room in a house. When these pipes narrow due to damage from high blood sugar, the heat cannot effectively reach the farthest rooms, causing them to remain cold regardless of how hard the furnace works. The cold sensation in your feet, in this context, is not about the external weather, it is about the internal pipes. Peripheral artery disease, caused by narrowed blood vessels, is a widespread condition, with diabetes being the single largest risk factor. Cold feet represent one of its earliest and most consistent symptoms. The most effective response to this sign is a brisk 30-minute walk every single day. This is not a leisurely stroll, but a purposeful walk with arm swinging, designed to force blood circulation into the feet and lower legs, strengthen blood vessel walls, and potentially reverse some early narrowing over time. If 30 minutes seems daunting, start with 10 minutes, as the crucial step is to begin today. Finally, the 9th sign is one that is rarely discussed, often missed even by healthcare professionals, and almost never noticed by individuals themselves until pointed out. This subtle yet significant indicator is a visible absence or thinning of hair on the lower legs and the tops of the feet. When observing these areas, there might be a noticeable lack of hair where it would typically grow. This quiet sign, easy to overlook, is a powerful marker of internal changes. Hair follicles require a steady and robust supply of blood and oxygen to thrive and produce hair. When circulation is significantly impaired by long-standing elevated blood sugar, the hair follicles in the feet and lower legs gradually stop receiving the necessary nourishment. Over time, they cease producing hair entirely. This pattern of hair loss serves as a visible marker of blood vessel damage that in many cases has been progressing silently for years. Consider hair follicles as small plants in a garden. If the irrigation pipe narrows or becomes blocked, the plants don't immediately die. They simply stop growing gradually. The absence of hair growth in these specific areas is your body sending a clear message about the health of your blood vessels, a message you can observe every time you look at your legs once you know what to look for. Research has established a significant correlation between hair loss on the lower extremities and peripheral vascular disease in individuals with diabetes, identifying it as a reliable, though frequently overlooked, sign that medical professionals are specifically trained to check for. After reviewing this information, take a moment to examine your lower legs and the tops of your feet. If the hair in these areas appears significantly thinner than on the rest of your leg, or is absent entirely, it is highly advisable to schedule a blood glucose test within the week. This simple test, often affordable and covered by insurance, can provide vital information and potentially alter the trajectory of your health. We have explored 9 distinct signs today, offering you 9 opportunities to detect potential health concerns before they become more serious. It is often challenging to witness individuals who have experienced several of these signs for extended periods, only to discover their underlying cause much later. This often stems not from a lack of care, but from a lack of awareness regarding what to look for. You now possess this vital information. We strongly encourage you to take one simple but profound action. Tonight, before you retire, take 30 seconds to sit down and carefully examine your feet. Observe the skin, look between your toes, check for any numbness, and note any wounds that seem out of place. Just 30 seconds. If you notice or feel anything on this list, please contact a healthcare professional without delay. The earlier such issues are identified, the more effectively they can be managed, often through lifestyle adjustments like dietary changes, regular walking, and medical consultation. Your health, independence, and ability to pursue what you love are invaluable. Do not let a manageable condition like elevated blood sugar compromise these aspects of your life simply because the warning signs were unknown. Now you are equipped with the knowledge. Stay aware, remain proactive, and diligently care for your feet.